Assalamualaikum warahmatullahi wabarakatuh. The Honorable Mrs. Dita Pratiwi Kusumawardani as the examiner, the Honorable Mr. Supriyadi SKM as the examiner, and the Honorable Mr. Arif Mulyanto SSC MSE as the supervisor and examiner in my proposal seminar. Previously, I would like to express my deepest gratitude to the examiner and supervisor for being willing to attend my proposal seminar today. On this occasion, I, Valinia Nabila, will present my proposal with the title of the difference in the quality of histopathology preparation of mother tissue in the paraffinization process using silol and ganapura oil. This research is motivated by the paraffinization. The initial step of staining is to remove paraffin from the tissue in making histopathology preparation so that staining can be maximized. Silol. This is a material that are effective in the paraffinization process but are toxic and have a negative impact on health and the environment. Ganapura oil. Therefore, other alternative materials are needed, namely ganapura oil, a natural material containing methyl salicylate, which is non-polar and can be used as a deparaffination agent, which is considered safe. And next, the tissue breast. According to from the Global Burden of Cancer in breast cancer in rank first, this causes histopathological examination of mammary tissue to increase, and breast tissue has a complex structure. And next, based on research by Farida et al. 2000, it was shown the guinea pig kidney preparation the paraffinization using ganapura oil so clearly visible nuclei as a result of perfect hematocyan and staining. The color intensity in the cytoplasma show a good cytoplasmic color and was comparable to preparation the paraffinization. Using silol, this support ganapura oil can be used as an alternative deparaffinization material. Based on the research, you need to determine the difference in the quality of histopathological preparation of mammary tissue in the deparaffinization process using silol and ganapura oil. Formulation of the problem. First, how is the quality of histopathology preparation of mammary tissue in the paraffinization process using silol. And second, how the quality of histopathology preparation of mammary tissue and the paraffinization process using ganapura oil. And next, is there a difference in the quality of histopathology preparation of mammary tissue in the paraffinization process using silol and ganapura oil? And next, research purpose. The main purpose to determine the difference in the quality of histopathological preparation of mammary tissue in the paraffinization process using silol and ganapura oil. And next, special purpose. One, knowing the quality of histopathology preparation of mammary tissue in the paraffinization from process using silol. Number two, knowing the quality of histopathology preparation of mammary tissue in the paraffinization process using ganapura oil. And three, knowing the difference in the quality of histopathological preparation of mammary tissue in the paraffinization process using silol and ganapura oil. And this is research authenticity I use. Next, literature review. Histopathology breast tissue has a complex and unique structure consisting of glandular tissue, connective tissue, and fat tissue. These structures allow track evaluation of the preparation process such as the fixation, cutting, and staining stage. And next, histopathology. Pathology is science that study change in the microscopic structure of tissue due to disease. This examination is important for diagnosing diseases, especially cancer, through observation of the morphology of tissue that has undergone tissue processing and staining. And next, histotechnique. This is a method for making histological preparation that goes through the process of fixation, dehydration, clearing, embedding, sectioning, hematolysis, staining, and mounting. And next, staining. This staining serves to clarify the morphological structure of the tissue, and the routine staining uses a hematoxylin eosin staining. In the staining process through several stages named devaporization, dehydration, hematoxylin eosin staining, dehydration, clearing, and mounting. And next, the paraffinization. This is an initial stage in the coloring process to remove paraffin from the tissue before the coloring process. So that coloring can be maximized. This process usually use a silol solution because it's effective for dissolved paraffin. Silol, aromatic hydrocarbon sulfate are commonly used the paraffinization for process because they are effective in dissolved paraffin. However, silol has the disadvantage of having toxic properties that pose a high risk to health and the environment. And next, Ganapura oil. Essential oil different from the leaf and the Ganapura plant contain methyl salicylate, which is a non-toxic, environment-friendly, cheap, easy to find, and non-polar, and he is able to dissolve paraffin in the paraffinization process. And next, theoretical from rock. Next, conceptual from rock. Independent variable, the paraffinization using silol and ganapura oil. Dependent variable, quality of histopathology preparation of mammary tissue. And hypothesis. Number 1, the quality of histopathology preparation of mammary tissue after the paraffinizing using silol is indicated by the clear purple color in the cell nuclei and the red color in the cytoplasm. And number 2, the quality of histopathology preparation of mammary tissue after the paraffinization using ganapura oil is indicated by the clear purple color in the cell nucleus and the red color in the cytoplasm. And number 3, there is no difference in histopathology of mammary tissue, the paraffinization using silol and ganapura oil. And next, research methodology variable. For free, the paraffinizing using silol and ganapura oil, and the bone quality of histopathology preparation of mammary tissue. The next, type and design. I used through experimental with post-test only control group design, and plus and time anatomical pathology laboratory of Dr. Susilo Regional General Hospital, Tegal Regency in May 2020. Population and sample. Population and mammary tissue found at Dr. Susilo Slawi Regional Hospital, Tegal Regency. Sample preparation into 2 treatment group. Sampling technique, random sampling. And next, sample size. I use software Power. And next, definition operational. And next, instrument. I use tool, cutting knife, tweezer, cassette, automatic tissue, processor, microtometer, bed, freezer, oven, dropper, pipette, object glass, embedding, and microscope. And material, I use mammary organ tissue sample, ganapura oil, antilam, paraffin, aqua, silol, hematoxylin, eosin, bullying solution, grade alcohol. This work procedure, the first, processing, embedding, sectioning, incubation, and next, processing of the staining of the cell nucleus and cytoplasm is clearly visible, less clear and unclear in the mammary tissue preparation. And Number 2, the preparation is observed using a microscope assisted by a specialist in anatomical pathology. And for data collection, primary data inform of the result of the quality assessment of histopathological preparation of memory tissue in the paraffinization process using silicon and ganapur oil. Data analysis of the quality of histopathology preparation of breast tissue in the paraffinization process using silicon was analyzed using a descriptive test. And number 2, data analysis of the quality of histopathological preparation of breast tissue in the paraffinization process using ganapur oil was analyzed using a descriptive test. And number 3, analysis of difference in the quality of histopathology preparation of breast tissue in the paraffinization process using silicon and ganapur oil will be analyzed using the t-test if the data is normally distributed, and if the data is not normally distributed, using the alternative meaning test. Research ethic, the research will be carried out after obtaining approval from the Health Research Ethics Commission of Medical University. This is a research flow chart that I use. This is research schedule, and this is a research cost data. Thank you. Assalamualaikum warahmatullahi wabarakatuh.